Commission. Thanks for joining us, Ma.
Thank you very much, presenter, and thank you for having me.
Before we go into the topic for today, we'd like for you to give us a brief introduction of what Oranghis is all about and what it entails.
Thank you. Oranghis is an acronym for a scheme developed at the table of the Ondo State Contributory Health Commission. And Oranghis is, from the acronym, it is Orange Health Insurance Scheme for all the residents of Ondo State, both formal and informal. We even have some other caveats, of residents that fall under the scheme, ranging from retirees, students, and the likes. So for Orange Health Insurance Scheme, it's majorly developed by the Commission to ensure that we give a kind of financial succor to our people in Ondo State. For us in Ondo State Contributory Health Commission, we also have some of our schemes that are equity scheme from the state government. We also have the ones of the state government, the federal government, like the ABA program, like the Abiyamo program, and we also have the Ilera Loro program also. That is the basic healthcare provision program of the federal government, the state government. So Orange Health Insurance Scheme covers a wide range of services for the formal sector that commenced in 2022 in December when the access to care commenced. We've had a lot of people, that have been enjoying the services under this scheme. So for Orange Health Insurance Scheme former, which covers the civil servants, political office holders, and their dependents, which is a family bouquet. It covers the principal enrollee, that is the contributor, that is the civil servant or the political office holder, and also the spouse, and 4 biological children below the age of 18 years old. Then now we are now moving to the informal sector scheme, which was flagged off in the year 2024 by His Excellency, Dr. Lucky Orimison Ayedatiwa. And for us in Ondo State, the governor is an amiable governor that said, okay, the formal sector people will not be the only one enjoying this scheme. Now let's look at how we can, extend this to the informal sector. That is the road transport workers, the traders, artisans, and whoever falls under the caveat, in as much they do not take salaries under the government payroll. So the government was, so magnanimous enough to say that let's ensure that we bring these people on board. So in September 2024, our governor flagged off this scheme so that we can reach out to these people. And the informal sector group of people that we've been meeting from time to time have been giving us a lot of commitment to say that they are ready to participate in the scheme. And also for the Orange Health Insurance Scheme, the benefits package is a very robust one. That is the arrays of services that you can think of that we have on this scheme. Okay. So for the benefits package, starting from the outpatients, we have arrays of services for consultations, a lot of things. We have surgeries that are covered. Appendectomy is there, cesarean section is there, hydrocelectomy is there, prostatectomy is there, mammectomy, some diagnostic services that are also there, ranging from CT scan, MRI, and the like. So you can see that it is, a kind of robust package that will be able to give a kind of financial support for the residents of Ondo State.
Thank you very much. That's like a very in-depth briefing about what it all entails. So now, but today our focus is on the informal sector. We know it's very easy for you to get those the people in the formal sector. Now, the informal sector, how is it easy? You already stated the people that falls into these categories. Now, how do you get them? And how do you let them that, oh, this scheme is available for all of you? Because initially you said this for the informal sector, it was just introduced in 2024. So yes, so how well have you guys made it known to the people that falls under this category that it is available for them?
Thank you. For us, the Commission, we have, you know, different departments that are in charge of different activities. And we've been able to see how we can collaborate very well with different associations, groups, cooperative society, market women, you know, and the artisans to ensure that we bring them on board. So even before the flag off of the informal sector scheme, since the inception of the commission was established by law and also the schemes. So when we started in 2019, we've been talking to different stakeholders, even before the flag off of the informal sector scheme, to say that these are stakeholders. How can we reach out to them even before we even flagged off the schemes for the formal and even for the informal? Because you agree with me that all the stakeholders are very critical to the implementation and the sustainability of the scheme. So in 2020, I remember during COVID, we even gave a kind of, you know, support to some of the associations, you know, to provide a kind of, you know, prevention for the spread of COVID at that time.
Okay.
And you can see that it's a conversation that has been ongoing for a very long time. So currently, we've been able to reach out to different associations ranging from the artisans, the market women, the Trade Union Congress, and some of the associations under the NLC. We have our road transport workers, the NURTW, the RTEAN, the RITIAN, and the likes. We have a lot of them that we have been, you know, having a lot of discussions with. And I can categorically tell you that some of them have shown their commitment by registering some of their executives, and some of them have even gone far by registering the executives and also some members of their associations. And we know that before the end of this year, and even before the end of this quarter, we will be able to say that this is a sizable, you know, number of this informal sector group that we've gotten.
Okay, so looking, for example, you made mention of the market women. Now, how are you able to deduct these commissions or money from them? Or is it free? We would like to know.
Thank you. Well, yes, for the market women and also other groups that I've mentioned earlier, the mode of payment of this premium in insurance, we refer to it as premium, you know, from them. That is the payment of their yearly policy plan. You know, the conversation has been that let's see how we can work together. I mean, we've been discussing with the stakeholders, what do you think can work best for you? Some of them came up with the idea of, you know, savings amongst them. And also we've been able to discuss with some MDAs, you know, because it is very essential for us to collaborate with some existing, you know, MDAs that are working regarding some of these informal, informal sector groups. So for us, we've been able to come up with so many seamless ways whereby we can,
easy for them.
Like we know of the thrift collectors, whereby the market women do drop a certain amount of money,
monthly or weekly,
maybe weekly or daily. So some of them said they will be more comfortable dropping it that way, and at the end of the month they collect everything together. Then some of them said they will be doing it that way, multiplied by 12, which is per policy year, whereby they pack the requisite number of people in that maybe market, parks, just like that.
Okay, so my question is, how effective has this been so far? Would you say it's, I would not really compare it with the formal sector, but how effective would you say it is?
Yes, you will agree with me that for informal sector, like what you said earlier, the informal sector population is a kind of, you know, it's not like the regular formal sector.
Yes, that's more organized.
That is more organized, so to say. And but they also have some other things they've been doing over the years, which we believe that if we leverage on such, we will be able to get this premium. And so far, it's been seamless because is not something that we even developed in silo without involving them.
Okay.
So their stakeholders were involved, like what I said earlier,
Yes.
in the development of the strategies
Okay.
that we can use in collection of their premiums.
Okay.
So for us, it's been a very seamless process. You know, it's been a seamless process for us. I know there might be challenges, you know,
Yes.
there's no program or, you know, project that you want to embark on that you will not see, challenges.
Yes.
But we've been able to surmount some of these challenges, and we have some people that are also working with us, because for us at the Commission, you know, we cannot be everywhere at the same time.
Yes.
We have 18 LGAs in Ondo State. That's 2 or 3 wards also that we have. So we have our agents that will be distributed very soon to these wards, and also the LGAs, which are which are even like ambassadors from these groups, associations, and you know, so that they can they are the ones that know their people, and they can always help us, you know, disseminate the information.
I was going to ask, like, how would you get to the grassroots?
Exactly.
Because it's not everybody that is, it's open for everybody, but not everybody have access to such information.
Exactly.
So I was going to ask, how do you intend to get through to those grassroots level? But then you just said they are going to be agents, not yet deployed, but would soon be deployed to those areas. And then I'm going to also ask, these benefits you talk about that you said it also includes their spouse and their four children, right? Below 18.
When I was explaining, I first explained the one for the formal sector.
Okay.
And
I was
for
going
the
to ask, does it apply to the informal sector?
Let me just explain.
Okay.
It's a two-way thing.
Yes.
So for the informal sector, we have the individual plan.
Okay.
Exactly. We have the individual plan. And so also we have the family plan. So for the individual plan, the individual comes to register as a person
alone.
Okay, and this person enjoys these areas of services I've mentioned earlier per policy year. Then also for the family plan, the way I explained for the formal sector is just the way it applies to them. And you will see that for the family plan, we have gone the route to say, okay, what can we do to encourage people to, you know, look at the benefits that is attached to the family plan. So there's going to be a discount. For example, a family of 6, which is supposed to be, is 18,000 naira per individual plan, and for a family plan that is supposed to be 108,000 for a family of 6, then it will now be 90,000. So that's the discount.
Okay,
on
but you said
family of 6.
when you explained, you said for 4 children. So now for a family of 6, how do they come in?
So, you know,
let's say they have 6 children and then the father and the mother, how do they come in?
Okay, let me just start from the explanation I gave under the formal sector. The formal sector, you know, I said is a family bouquet, and the spouse, apart from the contributor, which is the number 2 now with the spouse, then 4 children below the age of 18, which is 6 now. Can you, Then for the informal sector, so it is the same thing that is applicable there that is also applicable for the family plan. So anyone that wants, that have more children, or say spouses, so to say, is for them to buy an extra plan, which is the individual plan.
Okay, so now they'll do the family plan and add like single individual plans, like depending on the number of the individuals they are adding.
Exactly. And also the associations, you know, I said we've been talking with them, we've been having conversations, we've been having a lot of advocacies, sensitizations, and most of the times we always leverage on their monthly meetings. So we go there, we explain to them, we share the benefits package, you know, and also they have our client services call lines if they have any observations, queries, and concerns, which they can always use to reach out to us. So for the association, the opportunity is for them to, you know, come in large number, and you will see that they have a lot of opportunity embedded if they come as a group. Okay, so it's just like a group insurance, so to say. So there are so many benefits that, you know, is attached. You know, so many benefits are attached if they come as, you know, a group. So unlike the individual plan, the family plan, like I've explained earlier. And you will see that the government is doing a lot to ensure that our people do not suffer financial hardship. So when we started the health insurance percentage in Ondo State, looking at the National Health Insurance Authority and some private HMOs, we discovered it was very, very small. And by the time we started at the level of the Contributory Health Commission in 2019 till date, we have at least 1.7 or to 8%. That is close to 2% of the total population that we have in Ondo State. As at the last NDHS we recorded 5.4 million, of residents of this state. So you can see that the coming of the commission has done a lot, in the space of Ondo State. So that is why in the agenda of the new administration, under the leadership of our Amiable Governor, Dr. Lucky Orimisun Ayedatiwa, says our is the agenda. So looking at the effective healthcare delivery and social welfare under that agenda, you will see that the government is doing a lot to fulfill, their promises. And also for us as a commission, we are also not relenting in our hours to ensure that we fulfill on our own mandate, so that we can also, fulfill the mantra of our his agenda. So it's health insurance. It's the way to go, because that is the only way we can provide, financial succor and also reduce, hardship, financial hardship in the states.
Okay, just like you said, let's say, for example, when we have different local government. So if someone is to register for a particular scheme in one local government, how convenient is it for the person, in case the person is no longer in that local government and is moving to another local government? So yes, how convenient is it for that person to also locate and be this scheme will be available for the person? Okay,
that's a very good question, and it's so straightforward. If someone is moving from, for example, from Akure South local government to Akure North local government, it's just for the person to, change the facility from the Akure South local government to Akure North local government. So we have currently over 60 accredited facilities, which are both private and government facilities that we have in the state across the 18 LGAs. It ranges from the Hospitals Management Board facilities, it ranges, from Primary Healthcare Development Agency facilities, and also private facilities that are accredited to run these services for our residents in the state. So it's just for the person to change to another facility. And I want to ship this one in also. If, for example, someone is working here in Akure Metropolis, and the children are in Ilaje local government and with the wife. So it's just for the person to pick a facility in Akure South and also pick another facility for his family.
It's that convenient,
so it's flexible.
Very convenient,
exactly.
Recently, you donated some materials to us here in OSRC. So how do you source for these materials? Do you have supporters or do you have sponsors? So please enlighten us on that too.
Yes. Well, it's very straightforward. We are very open to partnership. Because there's no how you want to run a system that do not encourage collaboration with other MDAs. And you can see that for OSRC, you are a major stakeholder in projecting the information to the residents of the state, and so other MDAs also. I'm just trying to say that because I'm here. And for us, we also have a development partner that is working with us. So I think I'll use this opportunity to also say a special thank you to Clinton Health Access Initiative, CHI. They are the ones, helping us since the inception of the scheme that we've had so far. And we have other partners also, We have the ILO partner that is also working with us, regarding though the vulnerable scheme, but the distribution of items, we believe more in, partnership also. So from partnering, with different MDAs and also funds from this our development partners are also given, back to the system, because the government cannot do it all alone.
Yes.
So we need to support the government to ensure that, they fulfill on their promises and also fulfill on the mandates of, our own commission also.
Okay, so moving on, would you say that the formal sector, you've covered them all? Because now we are moving to the informal. So would you say, for you to now introduce it into the informal sector, would you say that you've covered the formal sector very well, and that was why you moved on to the informal
sector?
Yes.
Thank you very much. I think it's a very good question. The answer is not that we've covered all the formal sector, as a whole. I remembered when we started in 2022, I mean the Orange Health Insurance Scheme for formal sector. We started by enrollment of our civil servants at that time. And it was later that we said we do not want to, belabor them by bringing their dependents to a certain location for enrollment. How do we tell somebody in Ondo? How do we tell somebody in Okitipupa really, or in Akoko Northwest, Northeast, to be bringing their dependents because we want to do enrollment? And even if you say that we should bring them to maybe their LGA secretariats, at times all of them might not come. And, we don't want to, subject people to a lot of, problems. So we later started enrolling them, in proxy. So most of them will send their information through our desk officers, in these different LGAs that we have them, and we will register. So that has been able to help us to cover, a lot of people under the formal sector scheme. And generally, the formal sector scheme, like what we said, is a kind of, organized sector.
Yes.
So whereby we have their deduction list, from the Office of the Accountant General every month. So it is very easy for us to say that, okay, we've been able to register this certain percentage of people. So the ones left is only for us to reach out to them. And we have different work groups, and we normally ensure that we speak to them so that they can get enrolled. So currently, we've been able to at least register over 70% of the formal sector, individuals and families. So the informal sector inclusion is just for us to say that we are spreading our wings to cover more residents of the state. Since the formal sector people are enjoying, the scheme, let's bring the informal sector into it, so that, because they are the parts of people that, add to the GDP of the state. So why should we exempt them? So that's it. I will still continually mention that the governor was, magnanimous enough to say that let's include these people, so that, he can fulfill on the promises of the state government. So I think it's a kudos for the state governor. And yes.
To our listeners and our viewers, if they want to register, how do they register?
Okay, for now, we have our office beneath the the ground floor of the Ministry of Health in Alagbaka, Akure, and the name is Ondo State Contributory Health Commission. And if they are interested in registering, it's just for them to visit us there. And if they are not within Akure metropolis, they can as well visit any of our accredited facilities, across the 18 LGAs in Ondo State. So all government hospitals that we have for secondary level care that we have in Ondo State are registered under the scheme. So also some PHCs, the primary health care centers.
Thank you very much. What are your comments or advice for people listening?
Yes, I think it's just a short one. It's just for them to know that health insurance is the only way to go. And it is very important for people to join and participate in the scheme. So Oranghis Informa has been launched in the year 2024. September to be precise. So we are calling the residents of Ondo State to ensure that they participate in this scheme to reduce catastrophic, expenditure, right, which has been 16% over, the year. So please, it's very important for everybody to join.
Thank you very much. Thank you very much. I've actually learned a lot too, and I hope you viewers out there, you've learned a lot. So it's still Oranghis, and we say thanks for joining and bye.